They help heal with smiles and compassion. Their positive attitudes can go a long way when patients and family members are under stress. They deliver hope and help shape patients' first impressions of a hospital. They work without pay in a variety of hospital settings, but they are critically important members of the healing team. Meet some of Brevard's best hospital volunteers. A nurse for 5 decades, Ruth Hall worked in the surgical intensive care unit at Health First Holmes Regional Medical Center for 35 years. She retired in 2009, but never left home, because before she had even retired, Hall was already a volunteer at Holmes, and she remains there to this day. Recognizing the need to provide a warm welcome and support to visitors in the ICU, Ruth has for 11 years provided this support to thousands. As well, Ruth has served as an unpaid state ombudsman, a governor-appointed volunteer position. I advocate for patients in nursing homes, assisted living facilities, and adult living centers, explains Hall. When Dave and Leonora Mancini joined the auxiliary at Health First Palm Bay Hospital in 2009, the hospital got a 2-for-1 deal that was hard to beat. Dave serves as the chair for the team of cart drivers, those folks who make the hot, humid trek from the parking lot to the hospital a pleasant experience for visitors. Leonora is involved in several aspects of the hospital. At the information desk, she will ascertain that every visitor is identified and badged, and she will also field questions regarding the locations of rooms and services. As a leader of the Interview and Outreach Committee, she is tasked with both interviewing prospective volunteers and reaching out to recruit new blood for the auxiliary. A diagnosis of multiple sclerosis would sideline volunteer efforts for many folks, but not for Melbourne Regional Medical Center's Donald Shona. Don has been volunteering at both Rockledge and Melbourne Regional Medical Centers since 2014, accruing almost 2,000 service hours, says Sandy Williams, Director of Senior Services and Volunteers. Because of MS, Don has balance issues that force him to depend on a scooter. He tires easily, but he has found his niche behind a computer in hospital departments such as materials management, employee health, human resources, quality, and plant operations. I try to do the hardest job I am allowed to do, he says. I have to get out and do something useful. Helen and James Wellbeloved are indeed well-beloved at Health First Vieira Hospital, particularly among the physicians, for the husband and wife team are the leaders of the Nutritional Services team, which is tasked with making sure the physician's lounge is in tip-top shape when the doctors come in to rest and eat. We take good care of our doctors, says James. Since 2011, the Wellbeloveds have provided more than 10,000 volunteer hours to the healthcare facility. It's a tremendous environment in which to work, says James. It's given us big insight into what doctors really do. They really work hard and are considerate and caring people. Ruth Tatum calls Wednesdays her adult time, because that is the day she spends volunteering in the surgical waiting room of Rockledge Regional Medical Center, where Tatum greets loved ones of patients who are going through surgery. The rest of the week, you will find the 80-year-old Tatum at schools across the county. The substitute teacher has a soft spot for the kindergartners through 3rd graders, but she has taught all elementary school ages, whether mainstream or special needs. Her volunteer career at Rockledge Regional Medical Center began in 2004, and she has accumulated more than 7,600 service hours. I've been volunteering all my life, says Ruth. I'm just a people person. Once a nurse, always a nurse. That is the case for Sebastian River Medical Center Volunteer of the Year, Marilyn O'Keefe, who understands nursing inside and out and continues her connection with the medical field even after her retirement. I worked in nursing for 35 years and was a hospital nurse, a home health nurse, a school nurse, and a mental health nurse, says the Barefoot Bay resident. She now lends a hand at the pre-op ambulatory care unit, keeping the supplies in order, cleaning up gurneys, tending to patients' comfort, and wheeling them to their cars when they are discharged. I understand what the nurses and the patients have to go through every day, and I want to help, says Marilyn. At 90, Alice Seawood has no intention of taking it easy, particularly when it comes to helping her community. An active member of the Cape Canaveral Hospital Auxiliary for more than 20 years, Alice has given more than 18,000 hours of her time to the hospital. If you need help, just go ask Alice. She has always served as a dedicated and supportive chairman of all volunteer support services at the Merritt Island Healthplex, says Leon Schur, Cape Canaveral's manager of volunteer services. Alice manages the schedules of over 50 volunteers and ensures there is reliable volunteer coverage at all times, says Schur. Keeping track of all those hours and volunteers is a full-time job. As volunteer manager of the gift shop at Parish Medical Center, Martha Larcher is helping her favorite hospital with both time and money. It's not unusual for Martha to give as much as 40 hours a week to the gift shop, which raises considerable amounts of money for the hospital's auxiliary, which in turn supports many hospital-related projects, such as the purchase of wheelchairs and shuttles for patients. Raising funds for the hospital is noble, but the real reason Larcher volunteers is more personal. I really like helping people, she says. I like knowing that what I do makes life a little easier for someone else, or brings them a smile, or makes them feel loved. Your 2018 Central Florida Humanitarians, the Hospital Volunteers.